The flexor carpi radialis. The flexor carpi radialis. So this is a bulky muscle. Now let us look at its attachments. So the origin of the flexor carpi radialis muscle is from the medial epicondyle as a common flexor origin. So it also takes its origin from the antebrachial fascia, that is the deep fascia of the forearm. So another origin is from the antebrachial fascia and also from the adjacent facial septa. Alright, so this is the origin of the flexor carpi radialis muscle. Then this muscle forms a fusiform belly. Like I mentioned, it's a significantly sizable belly is formed by the after the origins of the flexor carpi radialis muscle, and this fusiform belly is replaced by a tendon in the lower part, approximately halfway down the middle of the forearm. Just above the wrist, it is accompanied laterally by the tendon of the brachioradialis, and the radial artery actually lies between the tendons of flexor carpi radialis and the brachioradialis. So what you find in between, we find the radial artery. Now let us look at the insertion of the flexor carpi radialis muscle. So the tendon of the flexor carpi radialis, it perforates the flexor retinaculum, meaning it passes deep to the flexor retinaculum, which is the thickened deep fascia in front of the carpus. And then it descends in an osteofibrous canal and it lodges in a groove on the trapezium bone. Okay, lies on the groove on trapezium. Okay, and it will be covered by a synovial sheath as it passes through this groove on the trapezium, covered by synovial sheaths. And then finally it is inserted to the palmar surface of the bases of second and third metacarpal bones. So that's the insertion of the flexor carpi radialis muscle. So it is inserted to the bases, palmar surface of base of second and third metacarpal bones. All right. Now, what is the nerve supply of flexor carpi radialis? So it is supplied by the median nerve, like the pronator teres. So it is supplied by the median nerve. Now let us look at the action of the flexor carpi radialis muscle. As the name indicates, it is the flexor of the radial side of the carpus, that is the wrist. Right, so it is a flexor of the wrist. Flexor of the wrist. Right. The flexor carpi radialis, along with the extensor carpi radialis longus and extensor carpi radialis brevis, abducts the wrist. Okay, these three together, they abduct the wrist. So this is about the flexor carpi radialis muscle. Now let us take a look at the muscle here. This animation, this highlighted muscle, this one here is the flexor carpi radialis muscle. So here is the action of the flexor carpi radialis. So it actually flexes. This is the flexor carpi radialis in blue color that flexes the radial side of the wrist. Right. Another action of the muscle is abduction of the wrist, and the abduction of the wrist is along with the extensor carpi radialis longus and the extensor carpi radialis brevis muscles. So the flexor carpi radialis along with the extensor carpi radialis longus and brevis, it abducts the wrist. Well, now so here if you look at the muscle flexor carpi radialis, this is the flexor carpi radialis muscle. So you can see that the origin is from the medial epicondyle of the humerus as common flexor origin, and it forms a fusiform belly and is replaced by a tendon halfway down the forearm, and it gets inserted to the palmar surface of bases of the second and the third metacarpal bones. So that's about the attachments of the flexor carpi radialis muscle. So our next muscle is the palmaris longus muscle. So the third one here is the palmaris longus. Now the palmaris longus muscle is highly variable. Some humans are born without palmaris longus because it does not have any significant muscle. Therefore, it is considered to be a degenerating muscle. It has got a short belly and a very long tendon. Now the origin of the palmaris longus is from the medial epicondyle together with the other superficial flexors. So medial epicondyle, all right, as common flexor origin, right, and it forms a very long slender tendon. Now what about the insertion of the palmaris longus? So distally this tendon passes in front of the flexor retinaculum, meaning it passes superficial to the flexor retinaculum, right, that passes superficial flexor retinaculum, and it is continuous with the central part of the and becomes continuous with the central part of the deep fascia in the palm, which is the flexor. In fact, it becomes continuous with the deep fascia of the palm. Okay, so that is called the palmar aponeurosis. So it is a thickening of the deep fascia actually. So this palmar aponeurosis earlier used to be a muscle. Like it will divide into 4 slips, then it gets attached to the medial 4 digits. But now, after so many years of evolution, the palmaris longus is just like a tendon, and it blends with the flexor retinaculum, right, and then further becomes this continuous with the central part of the palmar aponeurosis. So palmar aponeurosis is actually the degenerated primitive insertion of the palmaris longus. Degenerated primitive insertion, right. So that's about the palmaris longus. So what is the morphology of palmaris longus? So the palmaris longus muscle is actually going to become continuous with the palmar aponeurosis. So the palmar aponeurosis is the degenerated distal part of the palmaris longus. So it is actually a regressive muscle, right? It's a regressive. So okay, so it's a muscle that is regressing, means it's a degenerating muscle. So it's a regressive muscle, right. Some humans are born without palmaris longus. It can be unilateral or bilateral. So unilateral absence or bilateral absence of palmaris longus is rarely encountered. All right. So the nerve supply of the palmaris longus is again from the median nerve. So the nerve supply is median nerve. And what is the action? It is a weak flexor. Okay, weak flexor of the wrist joint. All right. Now let us look at this muscle here in this animation, in this 3D atlas. So look at this muscle here. This has got a very small belly and a very long tendon, and this tendon distally becomes continuous with the deep fascia of the palm. That is called the palmar aponeurosis. So look at this. So here is the palmar aponeurosis. This white structure is the palmar aponeurosis. The palmar aponeurosis, first it divides into 2 slips. Further each one of them divides into 2 more slips, and then it gets attached here to the superficial and deep transverse metacarpal ligaments, and also bases of the metacarpal bones, and also its superficial slip blends with the dermis of the palm. So this palmar aponeurosis is actually degenerated primitive insertion of palmaris longus muscle. So this little tendon can be seen, the tendon of the palmaris longus, right. Next muscle is the flexor carpi ulnaris. The fourth one, flexor carpi ulnaris. So this flexor carpi ulnaris muscle runs along the ulnar border of the forearm. Its origin, that is origin of flexor carpi ulnaris, is by two heads. Okay, it has got two heads of origin, and between the two heads of the origin we have the ulnar nerve entering the forearm from the the arm, beyond the sulcus nervi ulnaris. So what are the heads? The humeral head, and it has got another head that is called the ulnar head. So what is the origin of humeral head? The humeral head of the flexor carpi ulnaris arises from the medial epicondyle, that is the common flexor origin, together with the other superficial muscles of the forearm. Whereas the ulnar head arises from the medial margin of the olecranon process. Ulnar head arises from medial margin of olecranon process. Alright, and also it takes origin from the upper 2/3 of the posterior border of the ulna through a common aponeurosis. And this common aponeurosis is for the origin of two more muscles, that is flexor digitorum profundus and the extensor carpi ulnaris, that arises from the lower part. So that's the origin of the flexor carpi ulnaris. Now let us look at the insertion of the flexor carpi ulnaris muscle. So the flexor carpi ulnaris muscle has got a first it forms a fleshy muscle belly, and then it is replaced by a tendon in the lower part of the forearm, and the ulnar vessels and nerves lie lateral to the tendon. That is the relation between the ulnar nerves and vessels and the tendon of flexor carpi ulnaris. So basically ulnar vessels and nerve, they lie lateral to the tendon. Now what happens to the tendon? The tendon is inserted into the pisiform bone. Alright, so principal insertion is to the pisiform bone, and further through pisohamate ligament, the flexor carpi ulnaris is inserted into the hook of hamate bone, and also through the pisometacarpal ligament, it is inserted to the base of the fifth metacarpal bone. So this is the insertion of the flexor carpi ulnaris. Now what about the nerve supply of the flexor carpi ulnaris? So here you should remember that it's not the median nerve that supplies the flexor carpi ulnaris, but the ulnar nerve. So ulnar nerve, so it's a C7 fibers. We know the root value of ulnar nerve, C7, C8, T1. So these C7 fibers with the ulnar nerves are actually contributed by the median nerve from its lateral root. So the lateral root of the median nerve contributes few fibers from C7 root to ulnar nerve, and these C7 fibers are the ones which are going to supply the flexor carpi ulnaris muscle. Now what is the action of the flexor carpi ulnaris muscle? Right, so this is basically going to flex the ulnar side of the wrist. So it is a flexor of the wrist joint. Now the combined actions of the flexor and extensor carpi ulnaris produce adduction of the wrist. So flexor carpi ulnaris along with the extensor carpi ulnaris is going to adduct the wrist. Please remember, on the radial side we have the flexor carpi radialis. So the flexor carpi radialis together with the extensor carpi radialis longus and brevis abducts the wrist, whereas the flexor carpi ulnaris together with the extensor carpi ulnaris adducts the wrist. So that's the difference in the combined actions of the flexors and the extensor muscles. All right. Next, one more last muscle in the superficial region of the front forearm is the flexor digitorum superficialis. It is also known as the sublimis superficialis. So also known as the sublimus muscle. All right. Sublimis muscle. So this is a broad sheet of muscle and it lies deep to the other superficial flexor muscles of the forearm. Which other superficial flexors? Pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So the flexor digitorum superficialis lies in the intermediate layer between the first four and the last three muscles, the deep muscles of the front of forearm. Now let us look at the origins of the flexor digitorum superficialis muscle. So this muscle has an extensive origin compared to the other four superficial muscles of the front forearm. So it arises by two heads. All right, so it has got two heads of origin. One is called the humero-ulnar head, and the second head is called the radial head. All right, so this is the two heads of origin of the flexor digitorum superficialis muscle. Now, between the two heads of origins of the flexor digitorum superficialis, there is actually a fibrous arch, right, connecting the two heads, and beneath this passes the median nerve and the ulnar artery. All right. In fact, the median nerve is practically plastered to the undersurface of the muscle. So immediately beneath the flexor digitorum superficialis, you will find the median nerve running in the forearm between it and the flexor digitorum profundus. Now let us look at the humero-ulnar head, the origin of the humero-ulnar head. So it arises from humero-ulnar head of the flexor digitorum superficialis. So this muscle arises from the medial epicondyle, which is the common flexor origin. So one origin is from the medial epicondyle, and then it also arises from the anterior band of ulnar collateral ligament, anterior band of ulnar collateral ligament. What is ulnar collateral ligament? Ulnar collateral ligament is one of the ligaments of the elbow joint. Okay, and that's along the medial side of the elbow joint. So we have this ulnar collateral ligament also providing origin to few fibers of the flexor digitorum superficialis, and also it takes origin from the medial border of the coronoid process of ulna. All right, from the coronoid process of ulna. All right, so these are the origins, and this origin from the medial border of coronoid process of ulna is proximal to the origin of pronator teres muscle. So pronator teres muscle also takes its origin, one of its origins, from the medial border of the coronoid process. So when you look at the origins of flexor digitorum superficialis and the pronator teres, the origin of flexor digitorum superficialis is proximal to the origin of the pronator teres from the medial border of the coronoid process of the ulna. So that's the humero-ulnar head, right? Now the other head is the radial head. So what is the origin of radial head of flexor digitorum superficialis? So the radial head of the flexor digitorum superficialis takes its origin from the whole length of the anterior oblique line of the radius, the entire whole length of the anterior oblique line of the radius bone. All right, so that's the origin of flexor digitorum superficialis from the radius. That's the radial head. Now what happens above the rest? The flexor digitorum superficialis forms a fleshy belly, right? From this fleshy belly we have four tendons arising, and these four tendons are going to get inserted to the medial four fingers. So after the origin of flexor digitorum superficialis, it forms a belly, and this belly is going to divide into four tendons for the medial 4 digits, that is except for the thumb. So it divides into 4 tendons, right? Now these tendons are arranged in superficial and deep strata. There are 4 tendons, right? These 4 tendons are arranged as 2 plus 2, that is 2 tendons will be superficial and 2 tendons will be deep. All right, so this superficial stratum contains the tendons for the middle and the ring fingers. Okay, this is for the tendons for the middle and the ring fingers, and these fibers, that is the superficial stratum, these fibers are the ones derived mostly from the radial head. So superficial stratum, they arise from the radial head and they divide, they are going to get inserted to the middle and the ring fingers. What about the deep stratum? The deep stratum consists of fibers which form the tendons for the index and the little fingers. So the deep stratum provides, it gives rise to the tendons which get inserted to the index and the little fingers. Right, now let us look at the insertions of the flexor, the humeral ulnar and the radial heads of the flexor digitorum superficial. So the insertion is very important, and it is a bit tricky also, so I want you to pay more attention here. So the belly forms how many tendons? Now it forms 4 tendons, isn't it? So 4 tendons are formed, and these 4 tendons are arranged in pairs. 2 pairs, 2 are superficial, 2 are deep, right? And these tendons pass within the carpal tunnel. So they pass deep to the carpal tunnel beneath the flexor retinaculum, right? Now on reaching the palm, they diverge. Okay, so two tendons, okay, on reaching the palm they diverge like this into 4 tendons. Right, now on reaching the bases of the proximal phalanges, the each of these tendons divides into 2. Okay, so what happens at the bases of the proximal phalanges? Each tendon, how many tendons are there? There are 4 tendons. Each tendon divides into, okay, into how many? Each divides into 2, each divides into 2 slips. Okay, like this, each one divides into 2 slips. Okay, that's not it. What happens further? After the tendons split into slips, okay, they get twisted, and then they get each slip gets twisted. Okay, they get twisted, and then there is a twist. And so what happens during twisting? There is the reversal of surface. Okay, reversal of surface. So here, as you can see, they are getting divided into 2 slips each. Right, so after this they get twisted, right? They get twisted like this, meaning the lower becomes upper becomes lower. So this is straight now. So what happens if you just rotate it in this direction and this direction? So it gets reversed, the fibers get reversed. So the fibers above become, go to the lower part, and the fibers from the upper part go to the lower part, and lower part to the upper part. So they get twisted. So each of this gets twisted, each slip gets twisted. So after this twist, they reunite. Okay, so this split slips after twisting reunite. Okay, they reunite, and then they reunite, then they partially decussate, meaning some fibers from right go to left, fibers from left go to right. So they partially decussate. Not all the fibers from the right go to the left, or the from or all the fibers from left to go to the right. That is why I mentioned partially decussate, meaning some fibers of the right go to the left side, some fibers of the left side go to the right side. So it is called the partial decussation. And then they resplit, they reunite, then they partially decussate, cross to the opposite side, then they resplit. Okay, they resplit for attachments. Then they are attached to the sides of sides of shaft of the middle phalanx, okay, of medial 4 digits. Well, so nothing to worry. I will make this easier for you to understand. So the tendons, right, they decussate. Few fibers from the right go to the left, few fibers from the left go to the right. So there is decussation, crossing of the fibers, then they get attached to the bases of the sides of middle phalanges. Okay, let's just look at this in this picture here. So the flexor digitorum superficialis. So here is the palmar aponeurosis. Let me remove this deep fascia. Right, now see here, this is the flexor digitorum superficialis. Now this muscle, as you can see here in this region, all right, there is splitting, uniting and resplitting with the decussation of the fibers. So each of these 4 tendons, how many tendons are there for the flexor digitorum superficialis? See here, the 4 tendons which are arranged in pairs, superior pair, inferior pair, passing deep to the flexor retinaculum, and in the palm they diverge, right, diverge into 4 tendons. On reaching the bases of the proximal phalanges, they split, then twist, then unite, then resplit after decussation. Then they get inserted to the bases of the middle phalanges of the medial 4 digits. So that's the insertion of flexor digitorum superficialis muscle, as you can see here. So yeah, see the attachment to the sides on either side of the middle. So this is the concept here, the flexor digitorum superficialis. All right, so 4 slips, 4 tendons. For each tendon divides into 2 slips. These 2 slips, they get twisted, unite, decussate, resplit, then they insert to the bases of the middle phalanges of the medial 4 digits. Now what is the nerve supply of the flexor digitorum superficialis? The flexor digitorum superficialis is supplied by the median nerve. And what is the action of flexor digitorum superficialis? So the flexor digitorum superficialis produces the flexion of the middle phalanx, right? Flexion of middle phalanx. Okay, flexion of the middle phalanx. And that is at the proximal interphalangeal joint. Okay, so when it is further contracted, meaning prolonged contraction, the muscle fibers flex the metacarpophalangeal joints and the wrist joints. So its principal action is to flex the middle phalanx at the proximal interphalangeal joint. So on prolonged action, it flexes the wrist joint and the metacarpophalangeal joints as well. Right. So that's about the flexor digitorum superficialis. Let us just take a look at the actions of the flexor digitorum superficialis. So it is actually going to see flex the wrist, flex the metacarpophalangeal joints, and flex the proximal interphalangeal joint. So where is the proximal interphalangeal joint? Here is the proximal interphalangeal joint, that is between the distal phalanx and the middle phalanx is the distal interphalangeal joint. Between the proximal phalanx and the middle phalanx is the proximal interphalangeal joint. So flexion of proximal interphalangeal joint is because of the action of flexor digitorum superficialis. So this is about the superficial muscles of the front of forearm. So in this part we discussed these muscles, that is the pronator teres, its origin, insertion, nerve supply, action, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and the last one I discussed was the flexor digitorum superficialis. So we discussed these muscles under their origin, insertion, nerve supply, and action. We also looked at the 3D anatomical view of these muscles. Thank you very much.